Hello, my name is Rinn and today I'll be presenting on behalf of my team in the Mater Hospital, Optimising Perioperative Hip Fracture Care, an audit of early regional anaesthesia in the emergency department. Hip fractures are associated with significant morbidity and mortality, and effective early analgesia is an essential component of perioperative care. Regional anaesthesia offers excellent pain relief, whilst also reducing opioid requirements and their associated side effects. National guidance from the Royal College of Anaesthetists, the Irish Association for Emergency Medicine, and NICE recommends the early use of regional anaesthesia for these patients presenting with hip fracture. The guidelines also emphasise the importance of appropriate documentation, monitoring, and reassessment. The aim of this audit was to evaluate compliance with these standards, particularly focusing on analgesic efficacy, documentation, monitoring, and reassessment. So we conducted a prospective single-centre audit at the Mater Misericordiae University Hospital between October 2025 and June 2026. 58 patients with hip or proximal femoral fractures who received regional anaesthesia in the emergency department were included. And prior to initiation of the audit, a dedicated regional anaesthesia equipment trolley and a dedicated regional anaesthesia document were introduced in order to improve accessibility and standardisation across the department. So in terms of results, I will focus firstly on the right side of the screen. Where pain scores were documented before and after the block, we observed substantial improvement. Mean pain scores fell from 8.1 out of 10 before the block to 3.9 out of 10 afterwards, representing an average reduction of 4.2, and only 17% of reassessed patients required rescue analgesia. However, moving over to the left side of the screen now, compliance with documentation standards was variable. As you can see at the bottom of the screen, complete documentation was present in only 48% of cases. Moving up, post-block reassessment occurred in only 52% of cases, and complication documentation was present in 67% of patients. Importantly, no complications were documented in any patient where complication status was recorded. In conclusion, this audit reinforces regional anaesthesia as an important component of perioperative hip fracture care. The next steps are to deliver targeted education on documentation and to reinforce the importance of routine reassessment in order to fully evaluate patient outcomes and to also improve the patient's perioperative journey. Thank you very much.